Welcome back to another episode of the AAU Overtime Podcast live at the AAU College Hockey National Tournament. Jordan DeLuciano here as always, and joining me now is the Chief Medical Officer of AAU College Hockey, Dr. Jeff Poplarski. All the players have been seeing and getting to know Dr. Jeff this weekend, part of the PAR team, Performance and Recovery team, right behind us. Got a lot going on over there.
Yeah, we're the first ones here at the facility every day. We're here about 2.5 hours before the first game, and we're probably the last ones to leave the facility. We've been immensely popular, throughout the week, and I think the players are really enjoying the experience of getting some performance work done before games, and then the recovery aspect of playing hockey after games.
Dr. Jeff, you can definitely get the Ricola out on the table. The voice is starting to go. A lot of talking today. And throughout the whole tournament, the voice is starting to go, but he still popped on the podcast nonetheless. So, Dr. Jeff, what is something very common you're seeing this weekend, guys getting into work on?
Yeah, sure. When you look at the NHL statistics, what do they say? Any injury above the waist, they usually say upper body injury.
Yep, upper and lower, and that's
it. That's all they're really going to give you. But at the AAU, we're going to give you a little bit more information than that. The number one injury in the upper body by far is the shoulder. I think we've had probably about 20 separated shoulders, which is kind of the high point of the shoulder. It's kind of like a bony landmark on the high part of the shoulder. And that joint could get a little misaligned and some stress could go into that area. There's a ligament on top. Very common injury. We had about 20 of those. As far as the lower body goes, a lot of ankle injuries this year. More so than any other year that we've done this, because we've been with the AAU for 5 years, or CHF before that. But a lot of pucks hitting the boot, bone bruises, a couple of fractures. So that's coming in second place at this championship.
So ankles on the lower half and shoulders on the top half is like you said, ankles very surprising. What is more common on the lower body in terms of injuries?
Usually we see a lot of groin, but although we did have our share of groin, but the ankle seems to be number one. In fact, what we do at every championship, I'm constantly writing notes down. Like, what are we going to need next year? Always try to perfect it from an emergency standpoint. And the first thing on my list is 6 pairs of crutches, which we never brought crutches to this event. I would send them out to a local hospital, maybe go to a local CVS to buy crutches. But I think next year we're going to have those in-house based on the statistics of this year.
You learn from what you get this year and then apply to the following year and so on. Speaking of the lower body, I just came out of them. Tell everyone about what are those big black tubes that everyone's wrapping around their legs that are squeezing down the legs, and what do they do for you? Because I just came out of them. They feel great.
Sure. Those are called Normatec recovery systems. What it looks like for the audience, it looks like pants that are black kind of nylon that you basically put onto your legs. And then we compress air. It's air compression. It's almost like a large blood pressure cuff that goes on the arm. And what it does is it squeezes the muscles and it dissipates lactic acid, which is a byproduct when you skate. A lot of acid builds up into your muscle. All you have to realize is that if you ever got a burn in a muscle, that's the lactic acid.
Building it up, yep.
And then there's some enzymes that accumulate into the tissue too. So this is about recovery. We try to push that out of the way as quick as possible, and it just freshens the legs, and it gets the athlete ready for the next game the next day. Because as you know, you got to win 5 or 6 games in a row here, one day after another. So this is a tool that we're utilizing here that coaches and players realize that it's important to do this. And we've done probably 1,000 of those treatments this week, 20-minute treatments.
Yeah, I've been seeing guys hours before their game starts, all piling into that training area and just sitting there with their legs wrapped up in those tubes. But I also see you and Koji as well, your partner in crime. You worked on my vocal cords today, felt fantastic. What is part of the body that you're often stretching out during this tournament?
Yeah, sure. So let me just go down the list of what we have in the performance and recovery area. We have a doctor of chiropractic. We have 2 EMTs. We have a physical therapist. We have 4 athletic trainers covering the games, rink management, and then the performance and recovery team. So what we're doing is a lot of different things. For instance, athletes might come in and want to get that stretch with somebody assisting them. you were an athlete yourself. You stretch on your own, you can push the limits, but if you have somebody individually pushing you and maybe getting another 5 to 10 degrees on the tissue, that's certainly going to play a big factor from a performance standpoint. So we do like 15-minute increments on the stretching, especially the groins.
Yeah.
Big one there. Groins, hip, legs, and we'll go through that. We have a 15-minute perfected stretching program. Put somebody on the table, and we just run right through it.
The whole thing. So stretching his groins mainly you're seeing over there. And in terms of recovery now, what is an ideal way? There's never a perfect way. You can't go be 100% throughout a 5-day stretch in a row of games. So what's an ideal way for players to recover outside the rink? With you guys, they got great hands-on treatment, but when they get back to the hotel, when they get back home, whatever it be, what's a good ideal way to stay regrouped and ready to go for a quick turnaround the next day?
Yeah, great question, because that question actually came our way several times this week. You know what? An old-fashioned ice bath. Go to your hotel. You usually have every floor, you have an ice machine. Fill that bad boy, that tub up with as much ice as you can, and just sit in that tub for 20 minutes. Yeah. So ice bath in the hotel. Nutrition is a big one too, because I'm telling all the players, drinking the water, half your body weight in ounces of water. If you weigh 200 pounds and cut that in half, you drink 100 ounces of water daily. That's great for recovery too, because that's going to push out the acids and the enzyme too. So the difference of somebody not doing that, they're really challenging the system, and you can show up with some muscle cramping, and now the muscles can't contract like they need to, and then performance can go down. So between some nutritional consult, maybe doing that ice, and then also there's what's called a contrast, which is you get into the cold tub for 20 minutes, drain it, and then take a hot shower for 10 minutes.
What was that do? What would that do to the body?
That's a pump.
Okay.
That's called the contrast. So you're doing cold and then hot. And that contrast has an effect of pushing things out of your body too. Okay. Now, everything gets pushed out through the urinary system, and that's why you need to have that water behind it to try to assist in that process. Pushing it out. Yeah.
You see the ice baths, the ice tubs, the cold tubs getting more popular and popular. People buying their own ice baths or tubs, whatever you want to call it. What is the purpose of just sitting in that freezing cold water? What is that doing to your body?
Yeah. So when you put ice at that intensity, it squeezes and it constricts. So heat basically opens everything up and dilates it, but the cold constricts. So what that does, it helps to reduce inflammation in the body.
Okay.
The soreness.
Gotcha.
Yeah. And it's also great, like it produces hormones and enkephalins and endorphins, which are these molecules your body that can produce that makes you feel good. I don't know if you ever got the runner's high when you're running, and all of a sudden you're feeling really good.
Yeah.
Endorphins and enkephalins start to increase out of your body. The cold has that effect too.
Okay. Interesting.
And you feel great.
And you feel great after. Yeah. I haven't taken the ice bath since my playing days. It's been the ice tub, so it's been a long time.
Listen, Jordan, not to cut you off, I would love to have that here, but unfortunately, you have to have plumbing. You got to clean it out every time.
Yeah.
You have to have, literally thousands of pounds of ice. Mm-hmm. As you know, I do the U.S. Open Golf Championships.
Yes.
Also, we usually in the locker room setting, and we put those tubs right in the shower room, and it's easy for us to basically manage it in that environment.
Gotcha.
Where here it would be a little bit more difficult to do.
So at this tournament this year, new to you guys with the training staff, you're working on not just the guys, the girls are being at this tournament as well. They just wrapped up today. Paul Smith's your national champion for the women's division. Obviously, there's going to be some differences, Dr. Jeff, but take us through it, treating a women ice hockey player to now female ice hockey player to now male ice hockey player.
Yeah, sure. Excuse me.
All good.
There goes that cough again.
Yeah, that's why you got to get the cough drops going.
Yeah, so, let's just talk about a couple of things, like the differences between a male and female, just from a strength perspective.
Yeah.
So from the lower body down, like from the waistline down, most females are just as strong as males. They're about 90% as strong as us. But from the waist up, they're about 40% as strong as us. So they lose a little strength there. So that's in the back of my mind when I'm looking at hockey, because they're not going to be as strong, although they're not checking in this environment here. But that's one big difference between the male and female. Obviously, the size. Concussions, there's more incidence of concussion in female, just due to the fact that the musculature around the cervical spine is less. They don't have as much bulky tissue in the shoulders, so that head can kind of go in different directions without support. So that's in the back of my mind too. And the biggest thing is hormone production. They have a different set of hormones than males do, and that's always in the back of my mind from a recovery standpoint too.
Interesting. Yeah. So yeah, much different approach there. So now when you're working on, is there like, can you, when you're, let's say you're stretching a female athlete out to now stretching a male athlete out before or after a game, whatever it may be, can you go the same level of intensity when, like, let's say you're leaning into a male athlete, can you lean in a little bit more on him, knowing he can handle it compared to a female athlete? How's that work when now treating them off the ice, maybe just stretching them down or working them?
Yeah. Now I just mentioned to you hormones, and there was a reason why I said that, because females have different sets of hormones that actually soften their ligaments and their tendons. And as you probably know as a trainer, they're more flexible than males, right?
Yes.
Most females could go down and touch their toes, and they can take
The
their
splits,
legs, their splits and stuff like that. So now you have to go to that end range of motion where a male, we do a thing called the straight leg raiser, which is just taking the leg straight up as they're on their back. Most of these guys can get it up to about 90 degrees.
Yeah.
Females, 140 degrees.
Okay.
So they have hyper mobile ligaments and joints.
Gotcha.
Excessive movement compared to the males. And that could be, that's a challenge. A lot of people say, well, what's better? Is it better if you're hypomobile, less restrictive, or is it better that you're hypermobile? Think of a gymnastic.
Okay.
Is it better to have all that flexibility in gymnastics, or maybe not as much? And it's a debate. Really? Okay. What's going to happen, though, when you have injuries, most of these joints and muscles go into a hyperextended position. Excessive movement, right? The shoulder's going to go back into this excessive movement. But if you're hypermobile to begin with, it's been there already. It's not going to be as traumatic to the tissue where maybe a guy it might be.
So yeah, the girls are in that situation where they're used to being like, they can be stretchy more. They can pull. I'm trying to get more and dumb it down terms.
Yeah.
But the guys, they're not as loose, they're not as flexible. So that's where you feel that extremeness that they're not used to. Is that what you're saying?
Yes, exactly. Yeah. And they were great. Listen, the females came in here. Tampa is just one team off the bat. They were the first ones to show up here on that Wednesday. I met them in the lobby. I told them, like, really, you got a performance and recovery team here? I said, yeah, come on in. And the whole team walked in. And they were just delightful to work with, and they were very, very appreciative of what we did.
Everyone from top to bottom, male, female athlete, doesn't matter. Yeah, everyone is very appreciative of what's going on. But now you mentioned how common you see with the hockey player injuries, that shoulder injuries. With the girls, is it the same because they don't have body checking and hitting as much? So do you see the shoulder injury still prevalent, despite there not being as much hitting and physicality in the women's game?
Yeah, not as prevalent. We did see less teams, first of all, with the females here. So we did see, I saw maybe like 3 shoulders, a lot of knees.
Okay.
A lot of females have knees. There's a thing called the Q angle, which has to do with the pelvis and how the leg is aligned into the kneecap. You probably heard like a lot of females are susceptible to ACL tears, the big ligament, because their pelvis is a little bit wider. Another difference.
Yes.
And then the femur, that leg bone kind of comes down into an angle into the knee, and it's just not situated. It's not balanced properly. Puts a little undue stress on the knee, and they could get knee problems.
You mentioned all these biological differences, and I noticed it because I'm at home. I'm calling NCAA games for women's and men's ice hockey Division I. I know the skill level is different, but the way male and female athletes skate is different. Their strides are different, I've noticed. Is that because of just genetically and biologically built differently?
Yeah.
Their strides are different, I've noticed.
Yeah, well, the pelvis, right? The pelvis, which I just told you is a little bit wider in females, which, by the way, is the transmission of sports.
Yeah.
The pelvis is so critical when you're striding. There's 18 muscles attached to the pelvis. So the quads, the hamstrings, the glutes are all attached to that. And if you don't have, your pelvis is a little bit bigger, your stride might look different than maybe male.
Okay, that makes sense. As you were saying that, was the first thing I was thinking, because I noticed, like, just watching warm-ups and then even calling games, that their strides, they might be the same speed, the D1 athletes, like a girl might be the same speed level as the guy, but their strides, the way they step is very noticeably different. That could be a big reason why.
And that's because of the low body. That pelvis is really critical. It's a little wider, and the reason why the pelvis is wider in the females, number one, is the birthing process. That pelvis has to expand if they're going to have a child. and they carry a little bit more adipose tissue, fat tissue, in that pelvic region compared to males. And it's wider. And then it just creates some mechanical problems down into the knee. And that's why knees are pretty prevalent just in the general population of females compared to males.
All right. And now back to the equipment side. We talked about the big black tubes going on the legs. What other equipment do you have in there that you're offering up? I saw the guns as well. I forget the name of the Theraguns.
Yes, we have hyper-ice Theraguns, which are those electric massage guns that we could do it for them. It's always good to, you get on the table and someone's stretching you out and you're doing it for them. But those guns are really meant to where an athlete comes in, grabs one, goes in the corner, and just kind of activates their muscles.
Gotcha.
They could do it on their own. What's really immensely popular this week is cupping. I don't know if you saw the cupping.
I've had that done by you and Koji in the past, yes.
Yeah, cupping. I mean, Michael Phelps, about 10 years ago during the Olympics, showed up at a gold medal, swim event, and he had all the blemishes on his back. And everybody's like, what is that? What's going on? And that really propelled cupping in the sports world. So we have cups here. We have rubber cups, and we actually have cups where you could pump them up. And what cupping does is it pulls the skin a little bit off. And under the skin, it's for pain, by the way, under the skin, you have these receptors that create pain. They're called mechanoreceptors.
Okay.
So when you lift the skin off with the cup, it kind of relaxes those pain mechanoreceptors.
Okay.
So it reduces pain. Immensely popular. We have two types, like I said. The pneumatic one that you actually put air into it, and the other one is just a rubber cup.
Okay. Yeah, I've seen that. That one, the rubber cup, Koji did it to me a while back, and then I've seen the pump one very active. And you see, it's weird looking at it being done. Like, when it was done to me, I couldn't see it was on my back. But watching it being done, it's like a big black and blue ball that just pops up underneath that the pump. It's pretty interesting to look at.
Yeah. A lot of people come by, they're like, well, what is that? What's going on with that? But yeah, you'll see the skin pull up. The one with the pumps just a little bit more aggressive than the rubber cups.
Gotcha. Yes, I believe I had the rubber ones done a while back. But Dr. Jeff, I appreciate your time. If there's anything more you want to add, the floor is yours, I guess.
Yeah, listen, I think I said it last year on your show, who wins these events? I think the team that comes in more prepared, mentally and physically. I'm always coming from that body, skating connection, taking a shot, body swing connection. So the hydration and the recovery and the kids that are taking it a little bit more serious, I think are at a more of an advantage to win this. And we see that every year. Like I just told you, South Carolina was in our place like crazy, probably more so than any other team. And they just won the championship.
Yeah, they just took out Buffalo 4-1 that championship.
All the Buffalo kids came in.
Yeah.
But South Carolina, it seems like everybody was coming in from South Carolina.
Actually, what you're saying, remind me, before we go off, I'll ask you, hockey players, off the ice, when you're dealing with a player that's rehabbing from an injury, let's say it's a lower body injury, what is a movement or a stance or a part of the body you focus on when dealing, let's say, with a lower body injury with a player that's rehabbing before they get back? Is there a specific stance or part of the body you focus on that they have to strengthen up in order to, during the rehab process, get back on the ice?
Yeah, that's a great question. So we have the king of hockey, muscle-wise, is the glutes.
Okay. That's why everyone has giant quads.
Hockey butts, right?
Yeah.
You've probably heard that. But that glute is a major stabilizer of the lower body. So any type of rehab, I always go to the glutes first, and then we basically go from there. So the glutes are the king.
The glutes are the king. And now let's say upper body injury, say those shoulders. What is something that you're pinpointing during rehab and recovery to speed up, not maybe speed up, but to start up that process to get them back on the ice?
The more density or more muscle tissue you can have around the joint, the greater chance you're going to have to reduce injuries. So, we're working with these kids, and some of these kids are not big kids. You might be dealing with a kid that's like 5'6", 140.
Yeah.
And I was just talking to a coach the other day. He said, a friend of mine, I said, listen, your team next year, think about this, 30 kids next year, you have to gain 1,000 pounds of muscle tissue on your team.
They're going to bulk up.
1,000 pounds, 30 kids. So how much is that? That's like 30 pounds.
Yeah.
I would love to see his 140-pound kids get to 170 or 180, bulking up. So the more tissue around the joint, the more stability and prevention you'll have from injuries for sure.
So now I'm thinking of it as you're going with the lower body, the shoulder, upper body. Now something that's very, very important in sports. Maybe years ago wasn't as much of a concern, but now it's very, I was very important. I saw you working on some kid last night, is concussions. First step of a concussion process, whether it's you're working with the person individually, what is your approach, and what should people recovering from a concussion do when they're not with someone like you, when they're on their own at home just hanging around?
Yeah, so talking about another injury that's prevalent is concussions. But this year, only about 3 of them.
Hopefully.
This year.
Yeah, hopefully
the shoulders came in number 1. So there's a whole protocol on how to deal with concussions. Just a couple of little tidbits about concussion. Number 1, if you deem there's a concussion on the ice, there's absolutely no return to play criteria that day, and even for a week. If you basically deem it's a concussion, you put a kid back into the game that day, you could get brought up with criminal charges. So there's a whole return to play criteria. About 95% of concussions resolve within 7 days, and 5% last more than 7 days.
What makes them last even longer? Is it just bad identification immediately and it kind of prolongs?
So it's called comorbidities. There are things that are going to slow the process down. If you were dyslexic, if you have ADHD, if you're a hyperactive kid, if you've had prior head injuries or concussions, a big factor, or you had dyslexia, or you're already like psychotropic medications for head problems, it's a delayed response as far as healing the tissue.
And when you're running through that, when you said like prior concussions, that's what happened to me. I remember my 5th, the post-concussion part of it was horrible. It took so long to recover, and it was rough. You know, it kind of, your mind checks out, and it's like what symptoms was like depression, not having any will to do anything, just kind of like being sulked up for a month. It was not enjoyable because it was a long list of concussions that mounted up over time.
Yeah. The symptoms are, there's about 40 key things that you got to look for. Sensitivity to light, sensitivity to noise, confusion, feeling a fog, headache, and also what we tell the kids. So we have athletic trainers here that were managing the concussions on the rinks themselves. We also tell the kid if they're progressively getting worse during the day, you have to go to emergency room immediately. So you have to be monitored while you have the concussion for sure.
And you just went through a couple things there that like you're looking to identify, you're asking or you're looking for when someone's suspected of a concussion. But let's say, we'll try to get a specific example. You get on the ice, someone takes a hit to the head, noticeable. You get on the ice, what's the first thing you're looking at? You're looking at his eyes to see where he's at. What's the first question you ask him?
Yeah, great question. So there's a series of questions. They're called the Maddox questions. Person, place, time, event, who you playing, where you're at, who did you play yesterday, what conference you're from. You want to challenge the brain. And I've gone out and, done this to kids out on the ice, and they just look at you with like a vacant stare. They're looking right through you, and you know something's wrong. If you watch the NFL, they do the same thing. They ask a series of questions on the field, and then they pull the athlete and they put him in that blue tent for more extensive evaluation, like balance testing, memory recall. There's a whole bunch of other things you need to ask.
Remember, you asked me those questions. You asked me those questions during my playing days at Farmingdale. I remember you asked me, you said, Fairfield, where are we? What's the score? Who you're playing? I remember you asked me.
Yeah.
And now, I know this isn't hockey, but still on the conversation of concussions. In the NFL, you have the spotter that watches above. What is he or she looking for all the way above? What are they looking for when they see, like, that guy took a hard hit? What are they looking for to identify to see if maybe we should stop playing, get this guy off the field?
Yeah. So for years, how many concussions there were years ago?
Yeah.
When I was, I'm an older person. I mean, we used to get a bell rung all the time. No one was even mentioning concussions. Mm-hmm. And then, even in the 80s and 90s, coaches would put a lot of pressure on you. Like, no, you put it back. They're okay,
Yeah, suck it up.
Yeah, and then there was a lot of law changes, and which is great, state by state laws. So now you have an independent person who's not on the playing field, that has nothing to do with those two teams, and is looking at it independently up in the booth.
Yeah.
And they can hit a button that goes right to the referee, and the referee looks at it and he stops the action, and he'll say, Number 28 doesn't look right.
Yeah.
It looks a little woozy walking around. They get him off, and then they do the evaluation there.
Gotcha.
So there's been a lot of mismanagement and concussions. We just had one in the NFL for the quarterback for the Dolphins, like last year.
Yeah, last year he went back in and he wound up, it was like a scary scene. I think the next week he was like in shock there when he took that hit.
Yeah, that was another one, like don't return him right away. There's the return to play. There's a thing, by the way, just for your viewers, it's called posturing. When someone gets a really bad concussion, like neurologically, it's a massive problem with the brain, they'll start to kind of go into this like, almost like
That's happened to the quarterback on the
like
Dolphins.
a fetal position.
Yeah.
Or they might even go back like this. When you see that, you got a problem. And here's a really good one. And how many times have you saw this? Bell rung, got cobwebs in my head right here. When you just see a kid goes like this, just kind of shaking it off, guess what? That's a concussion.
Okay.
That's how crazy this can get.
Why are they doing that? Why are they doing that, shaking it off?
Because they're like trying to cobwebs in their ears,
okay,
like cobwebs in their brain, and they're trying to like shake them out.
Mm-hmm.
How many times have you seen that in a hockey event?
No,
even till today.
You see, now I'm going to keep looking. Now I'm going to really be looking
right?
for
That little bit of shake, yeah.
Yeah, in contact sports, but now I'm definitely be looking out for that.
And Jordan, that's why it's important when you cover these events from a sports medicine, EMT, paramedic, athletic trainer, sports physician, you have to look at the game. You have to be actively involved with the game. I say this all the time to my kids at Farmingdale. When I'm going to that game, I'm playing that game too.
Yeah.
Like you're playing, I'm mentally getting ready for this game. What am I going to see? The prior injuries, right? The other team, and we're trying to put it together. And, it's definitely mental preparation, but you need to see the mechanism of injury. MOI, mechanism of injury.
What does that entail?
That's seeing what happens.
Okay.
Right? Did the kid get blasted and went head first? Head went into that. What happens if I didn't see that?
Yeah.
The next thing I know, I looked up. What happened?
Yeah, and the kid's down. You don't even know how to assess it.
I know, man. He went in. That was the head. The head hit first, the shoulder. I'm thinking that right off the bat. Or the knee caved in, whatever the injury may be. But to see the mechanism of injury is another critical component of being a really good sports medicine person.
And how long have you been doing this, Dr. Jeff?
30 years.
30 years?
Yeah.
Well,
Yeah.
30 years well spent. Dr. Jeff Poplarski with the PAR team.
Yeah.
Performance and recovery. Dr. Jeff, I've known you for a while. Thanks for popping on the podcast. I'll let you get back to it. Maybe take a nap. You could use a break, right? All right. So Jordan DeLuciano alongside Dr. Jeff Poplarski for the AAU Overtime Podcast. Thanks for joining us. Tune in to more here at the AAU College Hockey National